Namaskara. I am Dr. Suhasini Inamdar. I am a consultant obstetrician and gynecologist, Motherhood Hospitals. Motherhood is a hospital which is NABH accredited, and we have a very advanced NICU which is level 3A. We take care of women as a whole. We take care of women from the childbirth, when she is a baby, till she is perimenopausal and menopausal. We have got all the facilities for the surgery, for deliveries and minimal invasive surgery. Today I would like to talk to all of you all about the adolescent health. Adolescence is the age which falls between age group of 11 to 19 years. And in this age groups there are boys and girls who are our future, who are the future of our country, who are the future of our society. They are the backbone of our society. So we should take care of their health to the utmost possible extent. So what are the issues normally we face with adolescent age group? These are the group which are having a very impressionable mind, and they get impressed by their peers, by their role models who can be TV stars, who can be movie stars, or who can be any sports stars. So let us talk about their physical health first. We have seen in India, though everybody is very aware about what they eat and how good they eat, but still we have seen that many number of boys and girls are having anemia. In this, the girls, almost 60% of girls are having anemia, and 40% of boys, they have anemia. And anemia basically is nutritional because of improper eating of junk food, and basically not looking into what they are eating and maintaining the timings. Another reason for anemia in both the genders is what we call as worm infestation. So if the boys and girls are not having very clean habit, they are eating outside food, not washing hands properly and all, they get infested with worms, and worms are responsible for anemia. In the girls, what we have seen is a lot of girls have excessive menstrual flow during their periods, and because of that they become anemic. These are very treatable conditions, and they just need to visit us once. We do all the checks, we check them up, and then we give the treatment accordingly. Another thing what we see is the deficiency of vitamin D and B12, and these both the reasons are very treatable. So for B12 deficiency, normally we give injections or tablets, and for D again injection and tablets are giving for a little longer term, and the anemias can be corrected. We again screen them for other disorders which lead to anemia, like thalassemia minor and all, and then we can correct those also. Another big thing what we see in this age group is obesity, which leads to high cholesterol levels and diabetes. The prevalence of obesity and diabetes in Indian scenario is just going higher and higher day by day. So we have to look into that. We have to motivate our children to go out, play, be physically active, eat properly, not eating junk food, not sitting in one place watching TV, doing their laptop work, and not bothering about what they're doing physically. Actually, whatever calories we consume, more than that or almost equally that we should spend every day, so that balance is maintained, and then the obesity problem can be taken care of. Another thing what we have seen is nowadays both the parents are working, and they feel that having one child is good enough to bring up that child to the most whatever advanced studies or advanced career, and they feel that they can fulfill their responsibility by doing that. But in the process, what happens? Most of the children, they feel very lonely. They start having suicidal tendencies, or else they go in for a depressive tendency, and they get addicted to maybe tobacco chewing, smoking, alcohol, or sometimes substance abuse also. So these are things which are to be looked into, because getting rid of these habits, these addictions, is a major issue, and it is very difficult. So let us keep in mind these possibilities also. And mental health is equally or more important than physical health. If a person is healthy mentally, definitely can be maintained well as his or her physical health also. So this also is very important to be looked into. So these things are about adolescence, and on the rise, what we have observed in our day-to-day practice is there are a lot of gynae problems which are coming in young girls. Girls of 13, 14, 15 years, they come to us with cysts, a lot of pain during periods, a lot of bleeding during periods, and these cysts are the major culprit in those cases. So we have to remove these cysts, and in our hospitals we have all the equipments and all the facilities for minimally invasive surgery, and we take care of this cyst by giving 2, 3, 4 small cuts and removing huge big cyst almost of 2 to 3 liters. So which is a beauty, because in a small girl nobody would like to have a big scar, and which is not only ugly but it is very mentally depressing for that girl to have such a big scar on her body. So we do this by minimally invasive surgery, which is basically laparoscopy, and all kind of cysts are first investigated, ruled out whether they are cancerous or not, and then we are taking care to remove those. We take care of other things in little elder age group which come with other problems of infertility. We do all the investigations in our hospitals. We are doing the surgeries for infertility. We do septal resections. We do endometrioma resection. We take care of endometriosis, and we make possible that the couple becomes pregnant in a very shorter duration, and we have all the treatment modalities for that also. So we do basic treatment like IUIs, we do IVFs in our facilities, and we have got very good responses. We are even doing cancer surgeries, which are, see the extreme cases of any health spectrum, but we are doing even those. We are doing cancers of ovaries and cancers of uterus in our hospitals, and we are getting very good results. And people are also very happy because our hospital is like their sweet home. We don't have atmosphere like hospital where a person is so scared to enter into. Our staffs, our paramedics, our office people are so very friendly, and they will just make you feel at home, and half of your worries and half of your botheration and half of your sickness is gone there itself. The medical part, the surgical part, we take care and make it very sure that you are completely and totally healed. So this is what we do when you come with problems of general health or specific problem of some gynae issues like of uterus or of ovaries. We take care of deliveries on a regular basis. We have the facility for normal deliveries. We have the facility for assisted deliveries. We have the facility for painless deliveries. On a regular basis, we are conducting painless deliveries, and all the mothers, they are very happy and comfortable with that. We also do cesareans on the regular basis, and there are various indications for what we do what. So depending on what a patient requires, we are giving them the treatment for that particular condition or the reason. We are taking care of babies as small as 28 weeks or even smaller. Up to 26 weeks also we have taken care of babies in our NICU. We have got a fantastic NICU team with us, and they have taken baby, and those preemies who are just 24-26 weeks have come up to 32 weeks, 34 weeks and healthily discharged home. So that is another thing which we look into and give utmost care, tender care I should say, to the babies and make them healthy and send them home. So these are the things which we are doing in the hospital, and giving them the best of our ability and best of our knowledge. We part with them and make them healthy and happy. Namaskara.
ಟಿವಿ ಲೋಕದಲ್ಲೇ ಮೊದಲು 3D ತಂತ್ರಜ್ಞಾನ, ವಿಭಿನ್ನ ವಿಶೇಷ ಏಕೈಕ ಓಪನ್ ಸ್ಟುಡಿಯೋ, ಸುದ್ದಿಯಲ್ಲಿ ಸದಾ ಮುಂದೆ, ಎಲ್ಲ ಪ್ರಮುಖ ಸುದ್ದಿ ನಮ್ಮಲ್ಲೇ ಮೊದಲು. ಪ್ರಭಾವಿ ಪ್ರಮುಖ ಗಣ್ಯ ವ್ಯಕ್ತಿಗಳ ಎಕ್ಸ್ಕ್ಲೂಸಿವ್ ಸಂದರ್ಶನಗಳಲ್ಲೂ ನಾವೇ ಮುಂದು. ಡಾಕ್ಟರ್ ವಿಜಯ್ ಸಂಕೇಶ್ವರ್ ಸಾರಥ್ಯದಲ್ಲಿ ಆನಂದ್ ಸಂಕೇಶ್ವರ್ ನೇತೃತ್ವದ ದಿಗ್ವಿಜಯ ನ್ಯೂಸ್, ಕನ್ನಡಿಗರ ಧ್ವನಿ. ದಿಗ್ವಿಜಯ ನ್ಯೂಸ್ ಎಲ್ಲ ಕೇಬಲ್ ನೆಟ್ವರ್ಕ್ ಹಾಗೂ DTH ಗಳಲ್ಲಿ ಲಭ್ಯ. ತಪ್ಪದೇ ವೀಕ್ಷಿಸಿ.